welcome back. You are still watching News at 8 on Church of Uganda Family TV. Now, this is a special segment where we are having an interview and we are talking about a critical issue. Now, we have just overcome Ebola, the Ebola outbreak. We overcome COVID-19 as well. And now there is a problem that's trying to rear its ugly head, which is the form of mumps. So that's the discussion we're having right now. And I'm having this discussion with Dr. Ahumuza Nicholas Marvin, who is a public health specialist. Welcome to News at 8.
Thank you so much for hosting me today. Just like my name has already been said, I'm Marvin Nicholas Ahumuza. I'm a public health specialist and an assistant lecturer at KIU. I work with Icon Medical Center here in Kampala, Wakiso, and also I'm a founder of Marvin Health Focus Initiative Limited, one of the charitable organizations in Uganda. So you are talking about mumps, and I know some people may not be aware that this is exactly what we have now in Uganda, but I would urge the public not to get so terrified or scared about it. But it is important to have the knowledge. It is important to have the information so that they can know about what is going on in the country. It is not only for the public use, but also it is also very important for our medical professionals and the medical practitioners in various healthcare settings, because some of them may not even be aware at the moment that we have the mumps outbreak, and some children or some people have already shown signs and symptoms. So like you said, by Wednesday 28th of December 2022, it had already crossed to more than 20 districts here in Uganda. Within the central region, we've had already Wakiso, we've already had Kampala, we've already had Mukono in the northern region of the country. We've already had Cheriandongo. We've already had Gulu in the eastern part. We've already had Jinja district in Mbalala, here, western Uganda. So it is really of public health concern that the public needs to know, though they don't need to be so afraid and terrified, but they need to have the information. Thank you so much.
Thank you so much, Doctor. What exactly is mumps?
Mumps,
where does it stem from?
Oh, that is so interesting. Mumps is a viral illness. It is a viral illness that is affecting, or normally affects, the young children, also affects the young adults. And what we need to know about it is that it is highly contagious. When we talk about it being highly contagious, it means that it easily moves from person to person. That is, moving from the infected person to someone who is not infected once they get into touch or once they are too close. So distance plays part in its transmission. So humans currently are the known reservoirs and hosts, meaning mumps lives within us, and majorly it lives within the respiratory tract. So once you inhale the mumps virus, then it is going into your respiratory tract and it replicates within your respiratory tract, meaning you are the one going to host this virus, and then you can pass it to the uninfected people.
Wow, that is serious indeed. So what are the signs and symptoms of mumps?
Yes, when you ask me about the signs and symptoms for the mumps, what we need to know about the mumps is that we always have the signs and then we always have the symptoms. And some of the people could not maybe know what they normally mean. But when we are talking about the symptoms, we are talking about what patients present with. For example, when you came in, find me in my office, what do you tell me? You're going to tell me you have headache. You're going to tell me you feel you're generally weak. You have general body weakness. You could tell me I have lost appetite. You can tell me I have a feeling like vomiting. When I'm talking about that now, I'm talking about the symptoms of mumps. So people are going to present to our offices with complaints of headache, complaints of low appetite, complaints of general body weakness, complaints of muscle aches and pains. So normally, those we call them prodromal symptoms, or we call them the non-specific symptoms people may present with, and they normally come in the first phase. Then later, they complain of swelling around the ear, but for us we call it the parotid region. That is where the parotid gland is. But for people, when they are coming, their complaint is they notice some swelling, at times with pain, around the ear. So that is what is the definite symptom. that they could know that we have mumps. Even people who have been seeing people get sick of mumps in their villages and communities, that is what they normally look for. But there are always some warning signs or prodromal symptoms which are non-specific, but most of the people, once they get that swelling and pain around the ear, then they could know I could have gotten mumps.
Now I understand there is no current treatment for mumps. Is that so?
Yeah, that is true. Before I can maybe talk about the treatment, like I had talked about the symptoms, that is what someone talks about. But for us, when you come, we look out for the signs. And when we are looking out for the signs, one commonest one is fever. You will realize that this person's body temperature has slightly gone up. Some may present with low grade and others may present with a high grade fever. But majorly, it is always a low grade fever. And when we try to palpate or touch around where you talk about the swelling, it is always tender, meaning there is some pain. And what normally confuses the rest is some people could develop lymph nodes. I don't know, you may not have heard about them, but some people may just have swelling of the lymph nodes and they may confuse them with the mumps. That is also something very important, because some people may just hear that there is mumps, which is characterized by swelling around the ear and something like that. And they may start confusing lymphadenopathies, or what we call swelling of the lymph nodes, to mumps. They are totally different. And any trained medical professional should be able to differentiate by palpating the swelling. The lymph nodes, the margins of the lymph nodes are quite different from the swelling of the mumps. So we also don't want that misdiagnosis that may end up making maybe mumps be seen to be highly virulent and maybe also be seen highly spread, yet at times it may be confused. Because when you get other respiratory tract infections, if you have cough, flu, at times our lymph nodes swell. And when they swell, now once there is maybe an outbreak of mumps, people may confuse the normal lymphadenopathies to mumps. So thank you so much for that. I think it can guide people about the signs and symptoms. The young children are going to start refusing to eat because when they eat, at times they feel pain on swallowing. They don't want to eat. Some may have abdominal pain. So they are generally non-specific symptoms, but with the specific symptoms.
And
the swelling.
Symptoms, since there's no treatment according to medical records, does that mean that what medical professionals do is that they just manage to treat the symptoms?
Yeah, exactly. Currently, what we are doing for mumps is supportive management. We call it supportive management. Like I said, there are non-specific symptoms. Leaving the swelling alone, the parotitis, which we are talking about, the swelling of the parotid gland. Leaving that alone, we have other prodromal symptoms, and they manifest differently. Different people may present with different symptoms. And currently what we are doing, just like we've been treating other viral infections, COVID inclusive, we've not been having specific treatment for that, but we manage symptoms. Someone's complaining of headache, then you have to go for a painkiller. Someone is maybe having a fever, you have to go for antipyretics like paracetamol. So someone's having abdominal pain, you just really see on how to control. But maybe what may go further that may need a detailed management could be complications of mumps virus disease. These mumps may complicate, and someone may present with complications. And that is what some of the people may not know. As a doctor, as anyone within maybe the clerking room, within the clinical room, you can receive a patient who is not presenting with the typical presentations of mumps, but is having complications. They may include otitis. Otitis is inflammation, or it is the disease of the testis. For men, they may even have some swelling of the testis and all that. So someone may present like that and you cannot really figure out what this could be. So that is why we normally say history taking is very important. We may have nephritis, that is inflammation of the ovaries. Okay, so we may have mastitis, the breasts may also be affected. We have pancreatitis, that is when the pancreas is affected, so forth, so forth. Most importantly, the brain. Some may present with encephalitis and meningitis, and those people may even present unconsciously. They may present when they don't even know what is happening to them. Some of them may present when they cannot talk, they cannot do anything because the brain has been affected, because these mumps also affect the brain.
So you treat the symptoms, but there might not be a prescribed treatment for mumps overall, but I understand that there is a vaccine. However, this vaccine is not in Uganda?
Yeah, the vaccine for the mumps, currently most of the developed countries, they are using the MMR, what is the measles, mumps, rubella vaccine. It is a combination vaccine that covers both measles, covers mumps, and covers rubella. All those are diseases. The measles, the mumps, and the rubella. But unfortunately, currently in Uganda, we are still stuck with the measles vaccine. So realize that when mothers bring their children for vaccination at 9 months, we give them the measles vaccine. And unfortunately, the measles vaccine only covers the measles part. It does not give protection against mumps. It does not give protection against rubella. It is quite unfortunate, but even in 2017, we also had an outbreak of these mumps here in Wakiso district. I think over 12 suspects for mumps were registered in 2017 here in Wakiso district. Advocacy is still ongoing through the Ministry of Health, so that it can advocate to the government, so that we can also start using the MMR vaccine that may also cover the mumps.
So right now, what can we do to curtail this issue since there's no vaccine?
Right now, what we can do is prevention. Prevention is the biggest part. One, it is also a bit maybe fortunate that some of the children are still within their holidays. So we've not had overcrowding of these children, but still we know the holiday spell is also getting expired. They are going back to school, and that is why we are saying that it may also disrupt their studies, because like in the definition I said, it is highly contagious, meaning if one child is coming with mumps to school, then he's going to spread it to other children. So typically it is really a challenge. It is really a challenge for us, but if you can, we are avoiding overcrowding. That is the most important thing we can do, because the risk for transmission increases with contact, increases with shortening the distance. What I can tell the children, especially the day scholars or the day schooling children, is that one, this mumps is funny. The incubation period is between 12 days to 25 days. Meaning when you get this virus, you are going to manifest, or you're going to have signs and symptoms between 12 days to 25 days. At an average of 16 to 18 days is when you are going to start having the signs and symptoms. And the most important thing in here is the infectious period. Within mumps disease, we have what we call infectious period. What is that period that you are highly, or you have high chances of transmitting this virus to the next person? And it normally happens 2 days before the onset of parotitis, or the onset of that swelling, because it is the typical sign or symptom for these mumps, the swelling around the ear, or what we call swelling of the parotid gland. So 2 days before and 5 days after the onset of that swelling is the highly infectious period. So we advise like the school administration or the parents to know that once your child maybe have developed that swelling, 5 days later, that child has very less chances of transmitting the mumps virus to the rest of the children. So what we've been doing to the children who are going to school, we normally say, once you develop this swelling, count 5 days after the onset of the swelling. And 5 days after, you can no longer transmit it to the other people. So that child can be able to go back to school. 5 days before, please stay at school. Because the 2 days before the onset, you may not even know. But at least you can count the 5 days after the onset of the swelling. So 5 days later, you are allowed to go back to school. But before you can finish the 5 days, or you can take it a week, you should stay home. So we advise parents in the school that once the child has developed that swelling around the ear, which they normally rely on to say this could be mumps, the child should keep home for 1 week.
In isolation.
In isolation, because at home it is better to isolate such a child from home than isolate from school.
All right, thank you so much, Doctor. And thank you for joining us on this special segment. Yes, prevention is better than cure. But if there's one thing that we have seen about Uganda is that we can handle whatever the enemy tries to throw at us. No weapon formed against us shall prosper. And with the right treatment, the right policy, and the right action from you and I as individuals and as parents, we can kick mumps out of Uganda. Let us continue with News at 8.